Now we're going to begin with some welcoming remarks by Congressman Bobby Scott. Congressman Scott is the chair of the House Subcommittee on Crime, Terrorism, and Homeland Security. He's the sponsor and the author of the Youth Promise Act. He's a big supporter of sentencing reform and treatment instead of incarceration. And he's an all-around advocate for public health and public safety.
Thank you, Bill, for your very kind remarks, and I want to welcome everyone here on Capitol Hill. Actually, the definition, the new directions in the title of the forum really answers a basic question as to whether we're trying to reduce crime or play politics. It's that choice that is, we've been trying to deal with I've been in public office for over 30 years, and we continually have to deal with the choice. So once you've made the choice, policy is easy. Once you've decided to play politics, you know what to do. Mandatory minimums, life without parole. If it rhymes, it's even better. If you do the adult crime, you do the adult time. Some of the policies are so bizarre and ridiculous. The one I like is no cable TV in the prisons. You can just imagine the cable guy coming in, disconnecting the cable, and everybody all over said, "Ah, now we're safe." This sloganeering has gotten us to the point where we lock up more people in the United States proportionally than any country on earth by far. And you have a workshop on that with several speakers who will go into detail. But it's gotten to the point where it's even counterproductive. The Pew Research Center says any rate over 500 per 100,000 is counterproductive. Actually, anything over 300 per 100,000, you get diminishing returns. But over 500 per 100,000, it's actually counterproductive. You're injecting more social pathology in the community than you're bringing out. We now lock up 700 and some per 100,000, number one in the world. In the African American community, it's over 2,000. 10 states lock up blacks at the rate of 4,000 per 100,000. Over 500 is counterproductive. If you look at those 10 states that are locking up blacks at the rate of 4,000 per 100,000, and the cost over 500, that's counterproductive incarceration. And target that money to 1/3 of the children. Just do the back of the envelope arithmetic. You're up to about $10,000 per child per year. Those slogans are wasting and counterproductive incarceration. And all that's the politics of it. Now we know from a substantive point of view how to reduce violent crime, particularly with youth, and that's a comprehensive approach starting very early with teen pregnancy prevention, prenatal care, nurse visits, early childhood education, get them on the right track, keep them on the right track. They don't get in trouble to begin with. It is a lot cheaper, and will convert what the Children's Defense Fund calls the present situation, the cradle to prison pipeline, convert that into a cradle to college, a cradle to the workforce pipeline. It's actually cheaper to construct that pipeline than the one we've got. We know that every time you do a comprehensive approach, it actually works. Boston had a situation where they had about a juvenile murder a month, about 12 or 13 a year. They came together as a community, got everybody around the table, had a comprehensive approach, and they went 3 years after that without a single juvenile murder. Pennsylvania put some comprehensive programs together around the state. They funded about 100 programs, about $60 million. A couple of years later, they looked back, that saved $300 million because they had done such a good job of reducing crime. There's a neighborhood in Richmond, had a $2.5 million grant from the Department of Justice, put together a little comprehensive program. The murder rate went from 19 a year down to $2.5 million. If you just look at the Medical College of Virginia trauma unit, you probably save more than $2.5 million right there. So we know that if we put together a comprehensive approach, that it'll work, save more money than it costs, and that's the idea behind the Youth Promise Act, where you get everybody around the table. You come up with, first of all, figure out how much money you're wasting on counterproductive incarceration. In some communities of 100,000 or 200,000, the number will be may well be $100 million in wasted incarceration. And if you have a program that's going to cut that in half, you need to you shouldn't limit your imagination to programs that cost $15,000. We know that if you put these comprehensive programs together, you can save money. The people around the table should commit to kicking in some of the money they save, not right off the bat, because they don't have the money, but as they save it, they can kick the money back in to keep the programs running. So we know these programs work. We know that when you're dealing with drugs, that if you put your money into rehabilitation, it's a lot cheaper and you reduce crime more than if you wait for them to get hooked on drugs and try to do rehabilitation after the fact, or you try to deal with it with prisons and interdiction. It is a much more expensive process than doing prevention, early intervention, and the rehabilitation. Drug courts have shown this. You put people in jail or you put them in a rehabilitation program, recidivism rate in rehabilitation much less, and it costs less. Or you can spend more and get more crime if you just lock them up. And that's the public health and safety approach. You're increasing safety. It's a public health, prevention, early intervention approach, and we know that, that those programs work. So we want to thank you, and let me just end with one of the challenges we have is whether we're going to do the prevention and early intervention or wait for people to mess up and then deal with the after effects. There's a poem 100 years ago, I'm not going to read the whole thing, but just the last two verses. A fence or an ambulance. What to do about people falling off the cliff. You could have two strategies. One, have an ambulance down in the valley to rescue the people after they fall, or you can put a fence around the cliff. And obviously what people want to do is they as soon as the accident occurs, they come running with great fanfare with the ambulance. But the poem ends by saying, but a sensible few who are practical too will not bear with such nonsense much longer. They believe that prevention is better than cure, and their party will soon be the stronger. Encourage them then with your voice, with your purse, voice, and pen, while other philanthropists dally. They will scorn all pretense and put a stout fence over the cliff that hangs over the valley. Better guide well the young than reclaim them from when old, for the voice of true wisdom is calling. To rescue the falling is good, but 'tis best to prevent other people from falling. Better close up the source of temptation and crime than deliver from dungeon or galley. Better put a strong fence around the top of a cliff than an ambulance down in the valley. That's what this workshop is all about all day. To the extent that you can show how easy it is and how sensible it is to have the prevention and early intervention approach, the public health approach, rather than wait for people to drop out of school, mess up, join a gang, and then get to a bidding war on how much time they're going to serve in prison. You're going to show that the sensible thing to do is the public health approach. We're wasting all this money in prison, and the politicians only do it because they think there's some political good to be gained. When they find that not only do you have the political support for a sensible policy, but that's the right thing to do, when they show the political support, people will stop doing the simple-minded foolishness and get serious about drug policy and take the public health and safety approach. So that's why I'm so glad to be here and welcome you to Washington. Wish you the best for the day-long seminar, and make sure that you let your members of Congress know what the sensible approach is. Thank you very much.